Is Governor Romney's successor in Massachusetts, the current governor of Massachusetts, Governor Deval Patrick. Governor, welcome back to Meet the Press.
Good morning, David. How are you?
Two key points here. How much damage has been done to the Affordable Care Act by you heard Governor Romney describe it as deception, not telling the truth about that people could lose their plans, and the failure for government to administer a program this large because of this failed website rollout?
Well, you know, the Affordable Care Act is not a website, David. I think Governor Romney knows that, and the American people know that. It's a value statement, and it does a lot of good for a lot of people. That has already begun and will continue. The website is imperfect. That'll get fixed. I'm confident of that. The website at home in Massachusetts, when we first started implementing in 2007, was also imperfect. It got fixed, and Governor Romney was right then when he said that if Massachusetts succeeds in implementing health care reform there, it will be a model for the country, and it has been.
But here is what President Obama said, would take you back to some of the comments he made back in 2009 and 2013, a promise he made, a fundamental promise he made to the American people. Watch.
If you like your health care plan, you will be able to keep your health care plan, period. No one will take it away, no matter what. So the first thing you need to know is this. If you already have health care, you don't have to do anything.
So no matter what, if you like your health care plan, you don't have to do anything. Was that a broken promise, or was that deception, or both?
Neither. For 95% of the people in America, that is the truth. For the small number of people who have a health care plan, which in fact will not insure them when they get sick, it is not true. And that's the whole point. If you have a pre-existing condition, if you have the kind of health care that disappears when you need it most, the Affordable Care Act says that has to end. It's also true that medical costs are number one cause of bankruptcy in America. That ends with the Affordable Care Act.
2 million people have been told that they don't have health insurance that they can keep. And then you say, well, you can get another plan, except you can't, because you can't get on the website. So was this not sold?
Excuse me, David, I'm sorry, finish, I'm sorry.
No, go ahead and react to that.
I'm sorry to cut you off. That's actually not true. The website is a convenience, and right now it's not working very well. But it's not the only way to get information. You can sign up on the phone, you can do it in person, and in very short order you'll be able to do it online.
Well, Governor, wait a second.
The obvious benefit of the website is to be able to compare plans, to shop, because as you shop, you save. And that's why it's urgent that the President get it fixed as soon as possible.
Here's what the Washington Post reports this morning, the anatomy of this debacle, and it quotes President Obama saying the most important part of the health care plan is the exchange that's set up, it's the website that's set up. And he said the following, according to the Washington Post: all of that is well and good, in other words, other things they're doing to get people enrolled, but if the website doesn't work, nothing else matters. And yet you're saying this morning that the website is not health care. It's just a website.
If the website is permanently flawed, we've got a serious problem. But we've got a rollout problem. It's been, what, 3 or 4 weeks? It took us 2 years to get our website right in Massachusetts. And now we have virtually universal coverage. 90% of our residents have a primary care physician. We are healthier. It has not broken the budget. More businesses offer insurance to their employees than ever before, one of the highest levels in the country, and it is approved by 84% of our population. So, you know, I think that what this whole situation has produced is actually a favor for the White House and for the President. I and many others have been saying the President needs to be out talking about the fundamental good that the Affordable Care Act does for people, and this is provoking him to do so, and I think that's a great thing.